30th of April today, last day of the month. Richie is at work and I'm in charge. It's a Thursday today. I have to think about the days these days because of, well, there just doesn't seem to be a weekend as such. You know, I tend to go through certain routines and sometimes I might find myself doing things I wouldn't normally do on a Sunday, doing them on a Sunday and things like that. So it's quite different now with this whole lockdown process. By the way, this camera I'm shooting on now is a GoPro just in HD. It's not the 4K camera with the adjustable Zeus lens, and therefore it's a good camera, gets some great wide angle shots. Sound is not too bad. It does upload far quicker on the various formats like YouTube and Facebook because of the not quite so good pixel quality. But it's high definition still, so it's not a bad picture. And I use it more for out and about, but sometimes for convenience sake I use it here as well in the office. Getting back to the whole process of lockdown, Boris Johnson will be talking to the general public, the nation, this afternoon at the briefing, from what I understand, to not talk about timeframes on when we're coming out of this lockdown or starting to move out of it. More, he's going to, I think, share with us some of the procedures will probably follow. Well, the press are guessing at the moment, so what we'll, rather than speculate on that, we'll wait and see. But he still gets significant criticism for basically not reacting sooner to the virus, and you know, it's being sort of reported on that way, not so much now from the BBC. Certain reporters, Sky News, are doing it more, and I noticed Al Jazeera have been picking up on it. They've tended to pick up on it on the basis of the media, the press, using it as an excuse. I think the press are quite honestly unreasonable in what they're talking about in terms of this, because I don't think we reacted too late at all. I mean, it's always, in hindsight, yes, you can always look back and say, well, probably we should have done that sooner, or probably we should have done that later, or whatever the case is. Wonderful when you have hindsight on your side of making judgment decisions, isn't it? But no, I think he took it on board, brought in the right kind of people around the cabinet to actually advise, and has been following that science and taking advice and making logical decisions based on the information. I think even when it comes to things like the care home losses with the virus, no, I don't think it was ever ignored. I don't think it went under the radar at all. Yes, I think there was a period of time when the main focus was getting hospitals ready for the demand. Basically what they saw happening in Wuhan and what they saw happening in Italy. They were working extremely hard to ensure hospitals were not going to be overrun. And they were working hard on that, getting ventilators, you know, through manufacturing and building new hospitals, and ensuring that the whole process of the hospitals were going to be able to cope with the process, which they achieved. I think testing then became the priority, and I think even testing, although we'll wait and see if we reach Matt Hancock's 100,000 being tested today or not. Probably we'll miss it by, 10 or 15 or 20,000, who knows. But even so, I'm saying that was a target he set himself, with lots and lots of obstacles he had to go at the same time. So I think that the fact is, I can't say that's a failure. If I look at testing in other countries, with the exception of Germany and South Korea, nobody's got testing right at all, I could say. And it's all in hindsight. But let's be fair, there has been an awful lot of work done in looking at what was anticipated as the high risks at the time. Now the high risk, the main focus, is certainly ensuring we don't have a second spike which overwhelms our hospitals in a second phase. That is absolutely critical for public health and for our economy. So I think that goes without saying. Certainly the deaths in care homes that have been reported more recently are a concern, and something that will have to be investigated, clearly when this is all over. But again, the press have seemed to pin it on the government as of having neglected the sort of social care side of the health service. And again, I dispute that. I think there are care homes that have possibly handled the situation better than others. And it's a broad, the care home service is broad. There are private operators involved, there are hospice, there's all kinds of various services, large and small, all, in my mind, at various standards. I've known that from the time of having my late mother in a home, in the latter years, and she was in several, because some weren't suitable, we found out after putting her in there. So it's, I think it's something that we have to look at going forward, for sure. I think we've always been aware of the fact that the old, frail individuals are more at risk to the coronavirus, as they are more at risk to any flu epidemic or anything else, that comes through the seasons. But I think to build up an attack on the basis of care homes were totally neglected, no, I don't think that's the case at all. I think the priorities were initially, let's get ventilators, let's get hospital beds up, let's have more, let's get the things in terms of treating this unknown disease, as it were, that we're still learning about, and the processes have all been correct in terms of fighting this disease over the last 7 weeks. I don't think there's been a problem with that at all. But yes, I do think there needs to be an inquiry as to really look at what we did well and what we could do better next time. I mean, I think that is important. As with any event that hits us like this, it's something I think we should be critiquing. But I don't think the media, the media are making accusations and attacks with really limited facts, limited information. I mean, they're even comparing us with other countries, whereas they don't know really how other countries are even reporting their dynamics. Spain doesn't record deaths in the same way as Italy, for example. And we know everyone has had problems in care homes. So again, Spain in particular has had problems in care homes. I mean, there was reports from the Spanish media that police found a care home where there were no staff in it whatsoever, and elderly people had been left lying in their beds, many who had passed away. I mean, it was horrific. Now, we haven't had any things like that happening in our structure, and I can't honestly believe we ever will. But then again, I can't honestly believe it was that simple in Spain either. But I think we're trying to compare us with other countries in terms of the numbers of people that have died with coronavirus or related to coronavirus is something we can only really critique 12-18 months from now, when all the facts are gathered. Going forward, we've got to look at this sensibly in terms of how we manage our lives. Clearly, we can't do what we used to do, particularly when it comes to public places, public gatherings, public entertainment. Social distancing has got to stay enforced until we have medication that can manage this coronavirus. So it's either medication that can treat it to ensure there are fewer deaths, or we get an antidote that we can protect a large proportion of the population with. Now, antidotes, I mean, again, the press jump on the bandwagon with this. Some of them talk about, someone's nearly found one, it's going to be ready in September, these things are going to take time. And antidotes, from what I understand, I'll have to be corrected from my medical friends out there, but you can get an antidote that will protect some people, but still won't protect everybody. So if, I don't know, at the moment we have no one's protected, say we'll get an antidote that we can put into people, into the system. It's going to take a long time to produce it, obviously, and get it into everyone across the world, but it will protect a proportion of the people. It won't protect everybody. It won't guarantee that you're not going to get coronavirus and die from it, any more than if you get the flu jab and 6 or 8 weeks later you die of that, of influenza. I mean, it gives you some protection. So there's a percentage. A jab isn't going to make you totally immune and you're never going to get sick with it. You probably are at some point in time. It's a question of how sick you get as to whether you end up in serious trouble with it, or whether you just brush it off like a bad cold. That's really what it boils down to. So the best advice is try not to get it. Try not to get anything, in fact, where there's potential risk to life. That's what's important. But I think when I was, making the point about living in Africa for a few years, in Nelspruit in the Lowveld, and which was a malaria hit area, and people who tend, and you can have protection against malaria, of course you can, but you can still get it even with that protection. And if you live in the environment for a long time, you don't bother taking any anti-malaria pills anyway. You just you become you succumb to it in many respects, and live with it. People will still die of malaria, sure, some will, but it's part of life of living in that part of the world, or in that part of Africa. And Africa, has spikes in malaria, like it has spikes in influenza and spikes in tuberculosis. These are things which happen all the time, and this is going to me, I can see the coronavirus being another one of those. It's going to, some people will never be immune to it, and if they catch it, it could be absolutely lethal. Other people could catch it, and it may be nothing, just a bit of an inconvenience for a couple of days. That's it. I think getting the ratios right is what's important. At the moment, people who go into hospital based on our numbers that are coming back from the from the statisticians is that it's about 30% of people who go into hospital don't come out. They are passing away. So that has concerns, but that's because at the moment there's nothing they can treat you with. All they can do is provide oxygen, and give you an oxygen treatment. And when you get very, very ill and can't breathe at all, you go onto a ventilator. Of course, once you're on a ventilator, you are, you don't have you're anaesthetized, so you don't have any knowledge of what's going on around you, and the machines are breathing for you. And while that's all going on, your heart's being watched and all your vitals are being watched, quite honestly, and you're being turned and washed and looked after for the period of time you're on a ventilator. And it could be weeks, it could be quite a while. People who go onto ventilators, again, then the percentages get even worse. Then there's a 50-50 chance that you'll come through it, and that's if you're fit. If you're old and you have a weak heart and whatever other things, the chances are very, very slim that you'll come through it. It's a chance. So you probably get a 20 or 30% chance that you might come through it then. So we must get real with this. It's a serious disease that requires a lot of respect until the scientists, the experts, can really understand what it's all about. So more information that started to come out from the facts of what's happened in the last 6 or 8 weeks is that people 70 plus are not necessarily the ones that are dying from this at the moment. They are taking the precautions and they are tending to be more elusive to the disease because they've been warned. But it's the 30 to the 50-year-olds which are falling down with this in larger numbers. Now, some of those 30 to 50-year-olds may have conditions they may not even be aware of yet. They may have some weakness in their immune system, or they may have some other. They may have a liver that's overworked, or kidneys not quite functioning right, or a heart problem that might be somewhere, or they may have the diabetes which they're not aware of, or they may have anything, and it catches them and they're gone. And it's and then people are surprised and say, well, he was only 35 and he was fit and healthy. Well, he obviously wasn't, or the disease got hold of him to such a point that they couldn't do anything to save him. And that's where the stories that you're coming through, and I'm just giving them as I'm hearing them, not from the media, but from people who have lost people to this disease in the hospitals here in the UK very recently. It's also the amount of health workers, doctors, nurses, people on the front line that have lost their lives in the last 6 weeks. I mean, there's something like over 100 health workers in the NHS that have now passed away. These are qualified, healthy people that have been working in the hospitals and in healthcare, frontline to assist with the patients in some form or other, and they have succumbed to this disease. I mean, reporters will say some of it's due to improper protection with the PPE. Some of that might be the case, but look, all these health workers are all aware of the risks they're taking every day, and they I've got to say they are I can't say enough about them and how good they are in what they're doing at the moment, because they do know the risks more than anybody else in terms of protection and everything else. So 100, yes, I mean 100 people losing their lives just on the front lines of the NHS in handling patients with this disease. I mean, it tells you that it's not something to mess with. And I'm really talking this aloud to, to countries that haven't got the situation that we have got in the UK at the moment. It's definitely a disease which is severe, that's difficult to read entirely. There's no doubt it's, in terms of it jumps from, it lives in people. It lives in people. So by cutting off, by this social isolating and social distancing and washing your hands, they are the key facts to keeping yourself free of it. The only other way you can get it then is through picking up the vapor droplets. This is the micro droplets, which is why the healthcare people on the front line get it, because they are close contact with the patients, obviously. But the risk factors are the supermarkets or any enclosed area, public space, obviously has got to be a high risk area for picking up the disease. If that's where the areas are, any public place. Hospitals, well, my own view on the hospital situation, Richie goes to hospital, she wears the correct gear, she has a shower before she comes out, and she changes and has a shower before she comes out as well, and she's in a situation where they take very strict rules in terms of contact continually. It is a process and routine. So I would say it's more unlikely to catch it there in a hospital scenario, because the hospitals are so well drilled in this process. I'm talking about outside the isolation areas where the coronavirus patients actually are. So they're so well drilled. I would say the risk factors there of picking up the disease are far less likely than picking it up in a public place, like a supermarket. That to me is still very high risk at the moment. Despite the changes and actions that are taking place, there are still lots of situations not being fully observed. And then on the weekends, when I see the people out and about in public places, crowding around on beaches still, sitting on park benches, crowding in sort of park grounds, sitting on the ground. Yes, it's outside, but when you get that amount of people together, you're still in a position to pick up vapor contact. It can happen, and I'm just making that point. It's worrying to see that we've been monitoring the transport and the foot traffic on a day-by-day basis, and in these monthly briefings, daily briefings, and it was worrying to see that that public transport was still well down, trains and buses, etc., still showing well down, but private cars were on the way up again, and so was the foot traffic, which they pick up on the Google Maps and things like that, plus what they observe. So yes, people are beginning to get lockdown fever, and I think they're coming out and they think, well, it's not going to happen, or it's not going to happen to me, or I'm not going to have a problem. But every one of those people is putting not just themselves at risk or their family at risk, but other people. It's going to put the NHS in a situation where it becomes overwhelmed. More people are going to be rushing into hospital, and there's going to be more deaths. And there's hundreds and hundreds of tragic stories we can talk about that have happened in the last 6 weeks, even now, just here in the UK. So I'm for the lockdown until they get this really under the thumb, until they've got it down to a controllable level. I'm not saying when they've got an antidote, I'm talking about get it down to a controllable level, and then it will be a question of easing it off very, very carefully. That's the only way we can get this we can survive in this whole process. If this disease hit us 100 years ago, it would have been a lot more fatal. There's no doubt about that. Fortunately, we have some common sense. There's a note just came up here: how to bag a supermarket slot. This is for the home deliveries, because Tesco and Morrison's, you can't get a delivery on to your home, because it's just overwhelmed. We've got a delivery coming today actually with Iceland. It was the only, I mean, I don't rarely do I shop at Iceland, but the kids, there's quite a lot of things the kids like in Iceland. So I've done a shop coming from Iceland, which is going to be here late this afternoon. So I'll let you know how that goes. But yeah. Anyway, talk to you again soon. Have a good day. Bye bye.